Welcome to today's webinar. Thanks very much for joining us today. My name is Donna Marin. I'm a registered nurse and a nursing advisor on the practice team here at the SRNA. My role today is to help facilitate the webinar. Before we start, I'd like to acknowledge that we are presenting from our office in Regina, which is on Treaty 4 territory and the homeland of the Métis. Our topic today is You Are a Leader. I'd like to introduce our presenter for today, Dr. Karen Eisler, RN. Before we get started, I have a couple of notes on how you can engage throughout the presentation. As a viewer of the webinar, you'll be able to hear and see the presentation, but only panelists will be able to speak throughout the presentation. If you have a question, please add them to the question and answer box or the chat sections. We will be monitoring this area for questions throughout the webinar, and these questions will be answered either live or via a typed response. If you wish to send your question anonymously, just text or check the box at the bottom of the Q&A screen. We will be recording this webinar, and it will be posted on the SRNA website for those who are not able to join us today so they can view it later. An email will be sent to you with a link for the evaluation. We hope that you'll take a couple of minutes to complete a quick survey. Now that we've finished with the housekeeping items today, I'll turn over the microphone to Karen Eisler. Thanks, Karen.
Great. Thank you, Donna, and thank you, Emery, for setting it up. And thank you for joining. As Donna said, my name is Karen Eisler, and I'm very proud to be here and present on leadership, which has been my passion throughout my career. The presentation is about 20 minutes, and then we can have open up for a Q&A. Thank you to the SRNA for having me present. And this presentation is similar to the one that I did at the SRNA annual meeting in May of 2018. I've been a registered nurse for 40 years this year. About half of my career was spent in ICU and emergency at the Plains Hospital in Regina, and the other 20 years in various administrative positions. And currently I'm the Associate Dean and Assistant Professor at the University of Regina, and I love my teaching with nursing students. This morning, I want to talk to you a little bit about leadership and you. Think about how you can demonstrate leadership as I go through these slides. Do you use the leadership competencies on your leadership journey? For my graduate research in my master's and PhD, I did study leadership and nursing, and that's what led me to the Kouzes and Posner's leadership practices, as well as the Registered Nurses Association of Ontario leadership practices, which I'm going to talk to you a bit about today. So over the years, there has been lots of research done on leadership, and specifically about nursing leadership. But in 1978, the seminal work of J. Burns, where he defined two types of leadership. One was transformational, you may have heard, and the other transactional. And he gave this quote, which I think is still pertinent today, 3 decades later. He said, "Leadership is one of the most observed and least understood phenomenon on earth." So much has been written looking for the gold standard of what is leadership to describe it and define it. And most common is that it is a journey and there is no end point. It is how you develop and grow your own leadership. Think about how many of you believe that leadership is tied to a formal position. Research has shown that leadership is actually throughout every position in an organization, and sometimes in the most unlikely positions. Kouzes and Posner, who I mentioned earlier, are the gurus in leadership in North America. They have researched leadership for over 3 decades as well, and they have demonstrated that if you use the 5 leadership practices in your journey, ordinary people can achieve extraordinary results. Their 5 practices are similar to the RNAO BPG's Best Practice Guideline Practices and the SRNA Leadership Competencies that I will talk about a little later here. Today I want to talk about the Best Practice Guidelines developed by the Registered Nurses Association of Ontario. And I'd like you to think about, as we go through, think about the leaders who have influenced you throughout your career. Think of those that have exhibited good behaviors in leadership, and perhaps some of those that you've learned not to do. Just a little bit before I go into it, management versus leadership. And I found this slide, it's a little old, But any of you who might have taken any kind of manager courses will see on the one side what managers do. And what they say here is they manage activities. And you might have seen commonly planning, organization, controlling, and more. On the other side, what do leaders do? And they tend to influence people. And they do that by their vision, their inspiration, their motivation, and the others that are on there. I found this was kind of a simple way to explain managers and leaders, because often it is confused that if you're a manager, you're a leader. Well, sometimes you're a manager, not a leader, and sometimes you're a leader and you aren't a manager. So I just wanted to put that at top of mind. So the next slide, it talks about the leadership competencies of the SRNA. And if you look at number 25, and I know you all carry around the SRNA standards of competencies with you and have them memorized, I'm sure. Number 25 talks about how you would demonstrate professional leadership in your career. And there are 5 competencies: building relationship and trust, creating an empowering environment, supporting knowledge development and integration within the team, leading and sustaining change, and balancing competing values and priorities. So I'm going to go through each of these, and you're going to see how you can maybe use some of the behaviors to address these competencies. And in my career, and when I've done the Continuum Competence program each year, I have taken some of these, sometimes one or more of these, and used them in my Continuum Competence plan. For example, building relationships and trust. Earlier in my admin career when I was a manager, I used that one to find out how do you build relationship and trust in a work environment. So you can use these in your Continuum Competence plan to develop leadership in your career journey. So these are the Healthy Work Environment Best Practice Guidelines that the Registered Nurses Association of Ontario developed. They do these with best evidence. I've listed 6 here, but there are now 12 on their website. They're all free to download. You can also order copies, and you would pay for them if you order paper copies. But they're free to download, and they are for all areas of practice. Whether you work in a clinical practice or in policy or administration or education, you can use these. They also have clinical best practice guidelines, and they have, I think, close to 40 of those. And there are things like managing a therapeutic relationship, looking after wound care, diabetes, how to quit smoking. There are many, many examples on their website, also free to download. And some are being used in facilities here in Saskatchewan. So as you can see, the first one is developing and sustaining nursing leadership. And I was very fortunate in the first iteration of this best practice guideline to be invited to be on the panel to develop it. And we went through mountains of evidence to develop this best practice guideline. And they can be used by registered nurses, registered psychiatric nurses, licensed practical nurses, managers, senior executives, CEOs, as a resource tool for everyday practice or to develop policies. I'm going to give a brief introduction to the leadership guideline, and I'm going to give you one behavior I'll get into it here. I'll show you. The RNAO BPG Leadership has the 5 leadership practices. Do they look familiar? I'm not going to read them again because they're almost exactly the same as the SRNA competencies. And that's because when the competencies for the SRNA were being developed, they looked at the Registered Nurses Association of Ontario Best Practice Guidelines to develop the competencies. So I'm going to go through each one of these. So the first one is building relationships and trust. And these are foundational to the rest of them. If you can't build a relationship and trust, then you are not going to be able to fulfill the other ones successfully. So I'm going to give one core competency, one sample behavior, and recommendations for an individual, team, and organization. And I will do that with each of the 5 practices. However, I want you to note that I'm only giving one. And there are hundreds of pages in the best practice guideline that give you way more competencies, way more behaviors, and way more recommendations. So I encourage you to actually read the document. This is just to give you just a basic foundation of what this leadership best practice guideline looks like. So the first core competency I pulled out was nurse leaders must demonstrate care and respect and personal concern for others. That sounds like it should be common sense, but I'm sure in your practice you have seen where it may not be so common. A sample behavior would be to acknowledge the value of others and celebrate successes. So important in our nursing environment to thank people for what they have done. Perhaps it might be a colleague that you have seen work with another patient or another nurse or another discipline, and you've seen them do something good. Do you go and thank them, or do you expect that to be the manager or the director or someone else that does that? I think individually we can all grow in this leadership. So recommendations for an individual that they have gleaned from the literature is that learning mentorship skills will help build this competency. So I want you to reflect. Do you mentor others? Do you know what mentorship is? Do you know that there's a difference between formal and informal mentoring? That's something you could use in your continuing competence plan to address this, this guideline. For a team, does your team look at focusing on what's possible as a team? Or do you look at what's not going right? Or do you focus on what's not going right and not look at the possibilities of what we can do to improve our situation, whatever it may be where you work? And as an organization, are there clear, accessible role descriptions? Because nothing can cause more confusion than if there aren't clear role descriptions for individuals on a team in an organization. The second one is called Creating an Empowering Work Environment. And again, I pulled out one competency, one behavior, and recommendations, one for an individual, a team, and an organization. And for this one, I pulled out that nurse leaders must understand and practice empowering behaviors. One time when I was giving this presentation, I believe it was in Ontario, some of the students put up their hand and go, well, what is empowering behaviors? Well, I turned back to the guideline and the literature. And the literature, lots of research done in Canada actually on empowerment. It means things like an ongoing dialogue with your colleagues. It means sharing the vision for the organization. And that doesn't mean that it is the board or the manager or the director that does that. It's everyone shares the vision and values. It means motivating others to make this a reality, to make the vision a reality for the organization. It means promoting the value of nursing and creating access to formal and informal power structures. It could mean letting staff design roles in decision-making. So being involved, perhaps, in an organization in decision-making, involving the nurses that are in that facility. It may mean things like optimizing the scope of practice at the point of care in all settings. Those are considered some empowering behaviors, which we could all learn to use better. A sample behavior could be to reflect on the use of those behaviors in our own practice. Individually, we could seek feedback on how others perceive our empowering behavior. So that fits as well with the continuing competence plan to ask someone else to maybe observe your empowering behaviors and give them a list of it and say, do I use these behaviors? Where do I use them well? Maybe where don't I use them, and how can I grow in this leadership practice? For a team, it might be that there are enabling nurses to participate in patient conferences and committees. I think that is happening more certainly in Saskatchewan, but we could do better at that. And an organization to establish mentoring and preceptor programs. And as I said before, have you thought about mentoring others, whether it be a first-year nursing student, whether it be a colleague, or maybe someone from a different discipline? The third one is creating a culture that supports knowledge development. And again, a core competency that I pulled out, and all of these, as I said, are evidence-based, is that nurse leaders instill a learning approach for continuous quality improvement. So are you looking at a sample behavior to provide time and discuss and address problems? I remember several years ago, well, perhaps it may be 10 years ago, in the SRNA survey, we asked nurses, did they even have team meetings? And it was a resounding, like 60% didn't have team meetings. Well, if you don't have team meetings, how are you discussing what can we do better on our unit or in our facility or in our organization? So is there time to discuss and address problems? Recommendations under this leadership practice are individuals have a personal commitment to ongoing professional development. For a team, it might be to conduct a needs assessment and develop an education plan for your unit. Is there an area of education where as a unit, you may be able to give better care if you had an education plan on whatever, XXX, whatever pertains to your unit? And as an organization, to use the best practice guidelines. So think about some of these things. Are you a role model in knowledge development or in your own knowledge development? Do you reflect on your own learning? Do you share that with others? Do you create a culture? Because we all have a role to play in creating a culture of learning. And the fourth one is leading and sustaining change. And one of the core competencies I pulled out here was that nurse leaders develop and implement mechanisms for feedback, measurement, and redesign during the change. So often we plan a change in an organization, but we don't follow through. We don't look for feedback, or we don't do an evaluation or redesign based on the evaluation. One of the sample leadership behaviors was to identify measurable goals and mechanisms to track progress. So if we don't track where we're going and how we're going, how do we know we're going to get there? If we don't have goals at the end that we measure, how do we know that we've gotten to where we want to go? And some of the leadership recommendations for individuals were that we understand and acknowledge that the uptake of change varies for each individual. So if you've ever experienced a big change in an organization, which I'm sure all of you have in the last couple of decades, no matter where you practice, there are people who are right on board right at the beginning. And there are people right at the beginning that say, no way, I'm not getting on that train, I'm getting off right now. And they may quit or retire. Fine, if they find something that they can do and not stay on and gripe about the change, that's good. And then there are a whole bunch in the middle that just aren't sure which way to go. Sometimes using these leadership competencies and behaviors will help us get to where we want to get with that change by being a participant. And then a team. Have we engaged everyone in building that vision? Perhaps that's why there's stragglers when there's change. And in an organization, have we communicated regularly with multiple methods? Just an example, when the Plains Hospital closed in 1995, and I'd been there, I think it was at that time 18 years or something, the management put up rumor boards all over the hospital. And they wanted every rumor that came up, and they answered them the next day. So you put a rumor in, up the next day came the rumor, and then the response to it. I think that was a really good way to show that everyone could be involved in the change and to catch rumors before they get out of hand as well. Because sometimes non-truths are circulated during change that are non-truths. And then the last one is competing values and priorities. Sometimes one of the more difficult things in leadership to do is to look at the values and priorities in an organization and determine where we need to go. So one of the core competencies, again, based on the evidence, is that nurse leaders advocate for resources. And to do so, those nurse leaders need to have evidence. It may be if they're looking at staffing changes, cutting budgets, but they need evidence to present to those who are making maybe the decisions. And sometimes they can change those decisions based on the evidence. Sample behavior could be to provide the data to demonstrate the need for resources. I remember this when budgets were cut when I was a manager at the General Hospital, actually. And education budget, of course, is the first one to go. And I remember advocating at that time for the new unit that we were having, that we needed education resources. And so I actually was able to provide the evidence to say how we needed that money in the budget for education in that unit. Recommendations for an individual. You could use the ethical frameworks to assist with decision making. So this is a little bit different than what I was talking about with financial resources. This could be using the code of ethics if you are involved in a decision that is looking at values and priorities. For a team, a leadership recommendation would be to establish forums for discussion of ethical concerns, and for an organization to have whistleblowing policies. These three recommendations do fit in with values and priorities, and research has shown are very important. But as I say, there are only three that I pulled out of all of the evidence that's in the best practice guideline. I want you to reflect on our code of ethics. So a new code of ethics was just approved by the membership at the May annual meeting, the 2017 CNA Code of Ethics. Do you use that for your decision making? Have you ever brought it out at a team meeting when you're looking at an ethical decision in your unit or your facility or your organization? Do you discuss regularly ethical concerns at your team meetings? Or do you discuss it with colleagues, and do you look at ways to address the issues? Does your practice environment encourage and support for identifying unsafe situations or unsafe concerns in the unit, facility, or organization? And do you work with others to address those? Have you brought your concerns forward? And more importantly, have you brought it forward with some options and solutions for addressing? It's very difficult sometimes in this leadership practice to grow in it, and I know I used it several times in my continuing competence plan over the years. But it is a journey, and as Kouzes and Posner have said, and the RNAO Best Practice Guideline says, it's a journey and we need to grow in it. And we need to practice some of these behaviors and competencies before we can become competent in using them. So I'm going to end with asking you to do something. I want you to think about your leadership journey. I want you to think about the leadership practices that I've talked about, the leadership behaviors, and I want you to write down one thing you will do this week to demonstrate your leadership in your practice and taking a step towards your growing in your leadership journey. You are a leader. Every one of us is a leader in our workplace and in our personal life. I want to thank you for joining the SRNA webinar today, and I look forward to any questions you may have. Thank you.
Thanks very much, Karen. I definitely, appreciated your presentation today, because you're right. I do very much believe it is a journey, and I certainly look back to when I was a new graduate and the leadership skills and style that I had then, because even back then I knew that I had to demonstrate leadership, no matter what chair I was in or what role I was playing as a nurse. But it definitely has been an evolution, and the more I learn and the more I reflect on the decisions I make and how I manage myself in clinical or administrative or educational settings, the more I feel that my skills are improving, and the ability to keep learning continuously throughout your career is a gift, really. And so I've had lots of discussions about leadership throughout the years, and even as a manager, it is very important to try and instill in everybody that, within the unit and within the contact that we have with patients or clients and their families, everybody does need to demonstrate leadership. So,
yes, thank you, Donna. Very true. And I think as registered nurses, the public expects that from us as well.
Yes, yeah, definitely. I'm not seeing any questions in the Q&A box, so I'd like to thank everybody for their attendance today. Next week's webinar Wednesday topic is titled CADTH 101. CADTH is the Canadian Agency for Drugs and Technology in Health, so they'll be explaining who they are and what they do and how their work can help nurses make clinical decisions. So if you have an opportunity to attend, that would be great. If you've missed any of our webinar Wednesday series, you can view them on SRNA's Vimeo or YouTube channels. All of our webinars we try to archive for people to access at their own opportunity. So thank you again to Karen as our presenter, and thank you for joining us, and we'll see you next time.
Thank you.